Start one.
Okay. Uh, Hello, friends. This evening I will be covering the basic physics of the bedside ultrasound, and I come from the city of Pune in India. So we do bedside rounds. This is a common enough feature of our daily morning. We see babies, and then suddenly a baby starts crashing, and we send bloods, and we need some quick results. And what are we looking at? Will a point of care ultrasound help? So, a point of care ultrasound is performed bedside, real time, by a physician or a neonatologist. And with the results, we need to interpret it correctly and integrate it into a patient care plan. So, the question that we need to answer is, will an ultrasound help? And to know about an ultrasound and to get good images, we need to know some basic physics. Now, physics is difficult enough for all of us, but I'll try and simplify it as much as I can. To understand our images, we need to optimize them well. So the basic idea of this presentation is to know how to optimize our ultrasound images well. So first we need to understand what is an ultrasound. An ultrasound is a high frequency sound signal which is emitted by a transducer, which goes into the baby in the form of a pressure wave, and it is reflected back and received as a sound signal by the transducer and converted into an image. So this sound signal is high frequency. It travels as a wave in a particular direction through a particular medium, and this can be reflected, refracted, or transmitted through tissue. But to understand ultrasound, we first go through certain terminologies. So an ultrasound wave has a positive deflection and a negative deflection, and this is one cycle. So cycle is the length of a positive and a negative deflection. The time it takes to finish this one cycle is called a period. So what is a frequency? It is the number of cycles per second and is denoted as a hertz. So if you have 1 cycle per second, it is 1 hertz. In this image, there are 2 cycles in 1 second, so it is 2 hertz. And a million cycles is 1 megahertz. So our transducers are anywhere from 2 to 15 megahertz, and that is the amount of ultrasound beams that it transmits. So what is frequency and what does the term frequency mean? So frequency, this is a waveform. It has got a certain number of cycles. Now, this is another waveform. There are more number of cycles. So the image above has a lesser frequency and the image below has a greater frequency. So low cycles per second is a less cycles per second is a low frequency, and more cycles per second is a higher frequency. Now the wavelength is the distance between two similar points on a wave. And so high frequencies have a smaller wavelength. Now amplitude is the height of the wave, and this is determined by, so when you have reflected waves, you need to determine what is the amplitude. So if you can't see the wave or you can't hear the wave well, you just increase the amplitude. Now, what are the properties of a sound wave? Properties of a sound wave are it travels in a particular direction. It has a particular cycles or certain frequency and wavelength, and it has to travel through a medium. And the tissue, the molecules in that tissue is set into motion. This motion is an oscillatory motion, and that is how the sound wave actually moves ahead. So in other words, every sound wave which travels has to travel through a medium. It can't travel through a vacuum. Now, what is acoustic impedance? Impedance is the resistance that a tissue offers for the sound beam to travel through it. Now, the image that you can see on the left is blood. Now, so when an ultrasound beam hits a blood vessel or goes into a blood vessel, a lot of it is transmitted and attenuated. There is a very poor reflection, so the image is seen as black. Now, if ultrasound wave or ultrasound beam enters a liver, a lot of it is absorbed and attenuated. There is some amount of reflection. The reflection increases as the tissue gets tougher. So a diaphragm, very little is absorbed and sent through, and there is a lot of reflection. But bones and stones reflect almost completely. They can never be absorbed or transmitted. So the images that we see on an ultrasound is seen in these various forms. Now this wave has a defined, as I've already mentioned, it has a defined speed, frequency, amplitude, wavelength, and direction. It is reflected, and this reflection is seen as echoes, and that is converted into an image format. Now the propagation speed of sound is different in different tissues. In air, it is 330 meters per second. In soft tissue, it is 1540 meters per second. That means almost 5 times. So virtually through soft tissue, sound travels at the speed of a supersonic jet. And through bone, it is 3000 meters per second. Now, what is sound and what is ultrasound? So the human hearing can make out sounds between 20 hertz and 20 kilohertz, whereas diagnostic imaging is between 2 megahertz and 15 megahertz. Now, in this diagnostic ultrasound imaging, Dopplers, it is when you get to actually do the Doppler, you can hear a sound. So that is in the audible human hearing, but all the other waves cannot be heard. Now, what is the connection between frequency and penetration? So an ultrasound transducer emits a wave. And here is another wave, which is higher frequency. The one with the lower frequency can penetrate better. The one with the higher frequency does not penetrate so much. But this penetration that occurs is at the cost of resolution. So waves that penetrate more, you cannot see the reflecting echoes very well as a waveform, which is with a higher frequency. You can see the images well, but it does not penetrate very far. So the inference to be drawn from this is if tissue is very deep down, for example, a kidney, lower down in the abdomen, then you need something with lower frequency so that it can reach up to there, but the resolution is not as good as some waves with higher frequencies. So higher frequencies have lesser penetration, but better resolution. Now here is a wave, ultrasound beam, which travels, and it doesn't travel at the same speed all the time. At certain times, it goes a little bit faster. At certain times, it goes a little bit slower. This is the medium that we can see. So this is known as compression and rarefaction, and its inference comes during, when I will talk about the harmonic imaging. So sometimes when tissues are pressed faster, the echoes are a little bit different from when tissues are pressed a little more slowly. So there are various kinds of echoes which are reflected at different periods of time. So what is a pulsed wave? A pulsed wave is a wave which travels for a short duration of time. Then the transducer listens to the reflecting sounds. So the transducer crystals talk during the generation of an impulse, and then it listens for a greater part of the time. So it is a short pulse and a long listen. And you'll be surprised to know the transducers actually emit pulses for about 1% of the time. And for 99% of the time, they're actually hearing, you're listening to the returning sounds or returning echoes. Now, what is the principle of ultrasound image production? So the transducer emits a wave, then there is a returning wave, and it listens to this. So this talking and listening is both done by a transducer, and then this gets converted into images. The transducer crystals decide the intensity of sound, the amplitude, it determines the size of the structure, it decides the pixels and also the brightness of the underlying structure. So the transducer is actually one of the most important parts of the ultrasound machine. So the production of an image depends on a pulse echo principle. So the transducer lets out a pulse, it reaches the heart, there is a returning wave, and this is then the transducer decides the image, and then it sends that information to the machine, and the machine then produces the image of a heart. So this basically is how the whole ultrasound machine works. Now I need to optimize these images. So in this cartoon, there is the red ball indicates my structure of interest, and I will now show how images need to be optimized. So here is my transducer. It is emitting an impulse. It's taking a long time because the image is right at the bottom. The wave comes reflected back, and so the transducer then determines that here is this image which is in the far field. Here is another transducer which emits a short pulse. The object of interest is very much close by, say let us take it as the heart, and then it is quickly converted into an image. And so it is determined that the image is close by. Now, what is echogenicity? Now, when ultrasound beams are sent to an image, depending on what is the tissue, some of it can get absorbed, reflected, or attenuated. So now here is this image which gets absorbed by the tissue. So when it gets absorbed, there is hardly or very little reflection, and that is seen as a black image. And you can see in this picture to the right side, this is the pulmonary artery. The blood is seen as black. So blood vessels would be seen as virtually black in ultrasound images. So blood is hypoechoic. All body fluids, it can be urine, it can be pleural fluid, they're all hypoechoic. Now look at this image on the left side. This is the abdominal ultrasound. This is the kidney and the adrenals, and here is the diaphragm. The diaphragm is seen as a hyperechoic structure. The one on the right, I have done an ultrasound. Here is the liver. Liver shows a lot of whitish structures. So this is calcification in the liver, and bones and stones are therefore hyperechoic. Muscle and fat are isoechoic. Look at the echogenicity of the heart. This is an inverted image. The pericardium and the valves are quite hyperechoic. Now, what happens eventually to an ultrasound beam which is sent out by a transducer? The ultrasound beam is either reflected, as in as is the principle in physics. It can be reflected, refracted. There can be a dispersion or scattering. It can be completely absorbed, or it could be a divergent view. Now the interface becomes important, and so when an ultrasound beam travels from a liquid into air, there is a certain amount of reflection. If it goes from liquid to a liquid, the reflection is less, it gets reasonably well absorbed, and if it is from a liquid to a bone, it gets pretty much reflected completely. So this is the reason for this interface is what we create when we use a liquid gel. And so this can be reflected, refracted, transmitted. There can be scattering, or it could be attenuated. So to summarize, what I've done so far is I've spoken about what is the cycle in an ultrasound, what is the frequency and what is its importance. It could be low and high frequencies and its connection to penetration. What is the wavelength of a cycle? What is the amplitude? What is the direction of any waveform? What is the medium? It has to travel through a medium. How images are produced by transducers, and what is echogenicity. But there is some more that we need to cover. Now, what is the relevance of focus in an ultrasound wave? So here is a transducer on the left. The transducer sends out an hourglass kind of image. So it is broad, narrow. This is called the focal zone, and then it is broad again. So this is the focal zone. And if the object of interest, the object to be interrogated, is placed on the focal zone, then the resolution or the clarity of the image is that much better. The image on the right, you can see there is a focus button on your ultrasound machines, and that focus button needs to be placed on the image of interest. So when you place that focus on the image of interest, then the clarity of the tissue is that much better. So here is an image on the left. The image should occupy, now on the right, it occupies a majority of the sector width, and that is what one should attempt to do. You should modulate or change your sector width, and so that your object of interest is covering a majority part of it, and the image quality is maximized at that point in time. So you have a focus button which could do that. Now here are two transducers of differing frequencies. The one on the left is a high frequency transducer, and the one on the right is a low frequency transducer. Now the beam which emits, the narrow part is the focal zone. So on the high frequency transducers, the focal zones are closer to the transducer crystals, whereas here they are more farther. So the higher frequency probes are used when structures to be interrogated are quite superficial. For example, preterm neonates. It can be used for cardiac chambers and superficial structures, whereas low frequency probes are used when the structures to be seen are deeply placed, as the kidney and deep abdominal structures. So these arrows, these two red arrows, are actually showing us what is the focal zone in each of these. The next issue after focus is resolution. The resolution simply means clarity to the image. So we need to bring a clarity to the images that we are trying to interpret. So here is a transducer, and this is the ultrasound beam. You can see that it looks like an hourglass. Now there are two kinds of resolutions. One is axial resolution and the other is lateral resolution. What do each of these mean? Now, if I have two structures along the axis of the ultrasound beam and they're very close to each other, the ability to differentiate them as two separate structures is actually important. Now, in order to be able to make out what are these two, sorry, just to what are these two structures, I must improve my axial resolution. And the way to do it is to have shorter pulses and to use higher frequency probes. Whereas lateral resolution is the ability to discriminate between structures that are closely placed in a direction perpendicular to the scan line. So if there are now there are two structures here in the near field, I will not be able to really make them out as two separate structures unless my focal point is there. At the focal point, I will very easily be able to make out that they are two separate structures. And in the far field, again, the two separate structures are usually will be seen as one. So I have to have a good axial resolution and a good lateral resolution in order to make out two separate structures. So higher frequency probes improve both the axial and the lateral resolutions, and the narrow beams have a better lateral resolution. So if I change or alter the frequency, I will be able to make out structures as two separate structures. Sorry, I think I have hung just a minute. Right. To continue, here is a table which indicates, now in an adult, I may have to go up to 30 centimeters in depth. So my axial resolution, I can't see structures which are less than 0.77 millimeter distance. So if there are two objects which are, closer than 0.77, they are only seen as one object. And similarly in the neonate, when I go through an imaging depth of about 6 centimeters, objects which are closer than 0.15, that means as long as the distance is 1.5 millimeter between them, I can see them as 0.1 millimeter, I can see them as two different objects. So in other words, higher frequency probes improves resolution in all planes. Now the next is contrast resolution. What does contrast resolution mean? I should be able to see different tissues with different shades of gray. So the ability of a machine to differentiate tissues with various densities is what is contrast resolution. And I should, different shades of gray tell me what are the different tissues. Now the example to this is here. The image on the left is poor contrast resolution. Everything seems black, but the image on the right, you can see how many shades of gray there are. So this is an abdominal ultrasound. This is the liver. This is the gallbladder in the liver. There are these different vessels and veins. And this is the aorta. And the one at the back, the hyperechoic structure is actually the spine. And within the blood vessel, you can also see one shade of gray, and that is a thrombus which was in the aorta of this newborn. So what I'm trying to indicate here is that the difference in these different grays tell me about the different structures, and having this contrast resolution is important. And finally, in the fourth kind of resolution, which is important, is the temporal resolution. This is to accurately locate the position of moving structures in a cardiac cycle. Now, there are two new entities that I'm going to introduce now: pulse repetition frequency and the frame rate per second. A pulse repetition frequency is the number of pulses which are sent out by a transducer per second, whereas the frame rate is the number of images received in 1 second. So they are two sides of the same coin actually. So what do you mean by this? Now supposing my ultrasound sends out a wave, there is a returning wave. Now if this is very slow, I have say something like 10 frames per second. My image is a little bit stop, start, stop, start. It's not a very smooth image. Whereas as I increase the frame rates per second, if I send quick pulses and I get quick echoes back, the frame rates are far better and I get a very smooth image. So the attempt should be to increase the pulse repetition frequency or the frame rates per second. So I need to quickly reduce the time gap between images in order to make a good image. So here is a cartoon that I've created. Now the one on the left, these red dots are the transducer crystals. This is my sector width. This is my object of interest. And these diamonds on the left are the focuses. Now, earlier ultrasound machines used to have a single focal point, but current ultrasound machines have many. The machine that I use, so your focus button will actually show you how many focuses you can get. It can go up to about 7 or 8. Now, in this image on the left, I send out an ultrasound beam, and these beams have to travel such a lot of distance. There are so many millions of ultrasound beams that are created in order to produce an image. Now, the one on the right, I have reduced the sector width, I have reduced the depth, I have reduced the number of focal zones, and there is less space for the ultrasound beams to each beam to cover. And so, therefore, I am able to get a better image because the ultrasound machine is not so taxed. It has less work to do. It sends out quick pulses and it gets quick returns in forms of echo. So I have to reduce, in order to get a good image, I have to reduce the depth of penetration. I must reduce the number of focal points and I must reduce the number of scan lines per frame. So I should use a narrower frame. So this is how images need to be optimized. So to overall summarize about how to get clarity to my image, I need to improve the axial resolution, lateral resolution, contrast resolution, and temporal resolution, all of them. And for that, I need to increase the frequency, reduce the depth, optimize the brightness of the gain, reduce the size of the image sector. This will help me improve all the types of resolution. Now here is a new terminology which I had earlier spoken about called harmonic imaging. Now when a conventional beam travels to an object, it returns, there is some amount of attenuation which takes place. Now these are not, they are linearly propagated but not at the same rate. So I had shown you there is something called compression and rarefaction. So in that process of compression and rarefaction, when the tissue within, the molecules in the tissue move, they move at differing speeds and there is scattering of echoes which takes place. So the echoes, there is a lot of noise which is created by these echoes. So the transducers are smart enough to be able to align all these frequencies. This is known as harmonic imaging. So when it sends out, the returning frequency is amplified and increased, and therefore the image quality is much better. So this is particularly important for structures which are very deep. So it is a good idea to have a harmonic imaging. There is a button for that, and that should be in an on position. So this improves the resolution of all the different kinds of resolution. Next, let us come to the transducers. Now, what is actually a transducer? A transducer has crystals which are called piezoelectric crystals. This is this green band at the bottom, and the size of the band is determined by the frequency. So the thicker the piezoelectric element, lower is the frequency, and the thinner the element, higher is the frequency. Now this is made of a synthetic element called lead zirconate. It's called lead zirconate, and at the back of it, it has a backing material which damps down waves. This is the whole structure of the transducer. Now the transducers have a particular footprint. The footprint is the amount that its contact with the baby's skin and the image that it produces. Now there are different kinds of footprints as can be seen in this image. So the linear arrays have a broader footprint, the curvy linear arrays have almost similar, and the sector have a small footprint, but it goes it's a broad picture of the structures that can be seen. So this is some of the transducers that I have in the unit. So these are called the sector probes. That is the image that is something like a triangle. So this is stands for sector, and these are multi-frequency probes, as all probes now come today. 12.4 is ranging from 4 megahertz to 12 megahertz. S83, this is a little lower. This could be used for pediatrics or for bigger babies. These are phased array. I'll come to what does phased array mean. And they're small footprint. That means even if they are placed on the chest, it can view it through the space between the ribs. And this is particularly used for cardiac imaging, and this is how the image is seen. Now the linear probes, they run from frequencies, say for example 3 to 12. They emit a rectangular beam. The near field is seen very well. It has a wide footprint. So this could be used either for lung ultrasound, even for abdominal ultrasounds or superficial structures. And it can also be used for head ultrasounds because the frequencies are a range of frequencies from 3 to 12. Head ultrasounds are also seen well. Curvilinear probes are lower frequency, so lower frequencies are for higher penetration, so deep abdominal structures are used. There is a wide footprint to this, and this image is how it is seen. There is a hockey stick probe. These are linear array transducers, and the frequency can range from this particular one is L7 to 50, so 7 to 15 megahertz. It is a very small footprint and can be used for superficial structures like nerves, etc. Now coming to an important concept of what is a phased array transducer. Now originally there were these sequential transducers, as you can see. These little red diamonds are the piezoelectric crystals. And it emits a rectangular beam. Now phased array transducers are all the transducers are used at the same time, and they emit in the form of a wave, waves on the seafront. There are waves which come, and this ability helps to steer the beam from side to side. And this is another advantage to this is you can adjust the focus easily to wherever you want to play, to your object of interest. One more advantage to this is that you can place the Doppler on this. So this helps in better image optimization. So basically about transducers and how you choose them. If you want a superficial structure to be interrogated, use a higher frequency, deeper structures, lower frequency. And all of us now have multi-frequency probes. So to summarize, what I have spoken to you in the last few minutes is about focus, resolution, and about the relevance of transducers and how to choose them. And all of them are used to get a best image. So some of the images here, now the one on the left, very blurred. I changed the depth and therefore the frequency, and now I can see a good sharp image. So deeper structures, I should use low frequency, superficial structures is a high frequency. Now here is a concept of gain. Gain is the brightness of an image. Now this is, but when returning signals are very, not very well heard or not very well heard by the transducer or not well seen, those returning signals need to be amplified. And this amplification is actually gain. It refers to the amplification of the ultrasound signals. So the picture on the left, the gain is very high. I need to reduce it in order to see it well. And so this gain basically refers to the brightness, and there is a knob on your machine to change the gain. So I just need to optimize the image that I want to see. Now here is something called the time gain compensation. There are a series of knobs. I need to place it in the center. And once I see that the returning signals are not good, I can use these knobs to change the amplification or increase the amplification if required. Now the next is depth. I need to change the depth. My object of interest should be somewhere occupying about 2/3 of the whole image. Now the image on the left, there is too much of depth. I can see too much at the bottom, which is not going to help me. The images here are too small. And here is the image, the object of interest has gone to the far field. So I need to keep the area, the structure that I want to interrogate somewhere between half to 2/3 area of the screen. So for a better ultrasound image overall, to sum it up, I need to look at the frequency. I need to adjust for brightness or gain. I need to look at the depth for magnification of the tissue. The focus is important, and also the width works, and the color, which will be discussed in the Doppler section. Now here is an image that I'm showing you. What I wanted you to see is, look at all the V's on each side. These are the focuses. The focus is seen as an inverted V image. So here in this image, I have 5 focal points. If I were to reduce it and get it to 1 or 2 focal points, my image would be better and brighter. Now, what are the imaging modes which are seen in ultrasound? One is a grayscale imaging and the Doppler imaging. So I'll be speaking about the grayscale imaging. The A modes are not used anymore. They are used in ophthalmology. B mode is the brightness mode, and M mode is the motion mode. So this is the brightness mode, or the grayscale imaging. Here I can see all the tissues. I can see some hyperechoic, some hypoechoic. And this 2D image is used to measure the cardiac chambers, assess valvular functions. Whereas the M mode is a motion mode. It is evaluates the movement of structures such as the heart wall and the valves over time. So the ultrasound beam is a single beam is sent at a particular point in order to see what are the structures moving at that point. Now the image on the left, I send the transducer beam, and what I can see is I've sent it through the aorta and the left atrium. This is called the parasternal lung axis view, and I'm able to use this in order to measure the LA aortic ratio. So the x-axis I measure the time, and the y-axis I measure the distance. So this is for the LA aortic ratio, and the one on the right I send a single line of sight, and I'm able to look. This is through the mitral valve, and this is used for things like fractional shortening, ventricular functions, basically. So in a motion mode, what I'm going to do is I'm going to send a single line of sight and see what are the structures which are moving at that point. And color Doppler, which will be covered later, it just shows the flow of, say, blood from one area to another. So it shows the direction, the velocity, and therefore I can calculate the pressures. The image on the left shows a duct, and the image on the right, I'm able to see blue color, which indicates a TR jet, that is, blood flows from one chamber to the other, and I can convert it into pressure gradients. So basically, Dopplers are useful in blood flows. It shows the presence of a particular flow, the direction and velocity, and measurements can also be taken. It is particularly useful in pressure gradients, like in PPHN, stenotic lesions, regurgitation, etc. So this is a pulse wave Doppler. It is that same image that I had shown earlier. On the blue wave, I placed the pulse wave Doppler. I convert it into a pressure gradient, and then I'm able to measure the pressures, the pressure gradient between, say, the right ventricle and the right atrium, and therefore infer what could be the pressures in the pulmonary vasculature. Finally, the tissue Doppler imaging. Tissue Doppler imaging is the Dopplers or the velocities in the heart muscle. So far, we've been looking at the, through the blood flows, but the heart muscle moves a little more slowly, and this is one modality to be used. Now, there are ultrasounds are not all good. There are certain artifacts which are seen. What are artifacts? They are appearances in an image that does not accurately reflect what the tissue is being imaged. For example, now the image on the left, the ultrasound beam, it appears there is no, this is the atrium, the right atrium and the left atrium. This is an inverted cardiac image. It appears, this yellow arrow indicates that it appears there is no tissue there at all. So is it a single atrium or something? But actually the atrium is so thin that it is not, the reflected waves are not seen. And these are called dropout artifacts. So I change the image. This is a subcostal view. The earlier one was the apical four-chamber. This is the subcostal view, and I can actually see the interatrial septum well. So either the tissues, it appears as though the tissues are not actually present, or they are not seen, or they are seen in different shapes and sizes. One needs to be aware of what are different kinds of artifacts. For example, now this is an abdominal ultrasound. This is a gallbladder. There is a stone at the end of the gallbladder. And because everything is reflected here, at the back of it, I can't see anything. So it appears as a shadow. It appears probably that it's a cystic lesion there, but this is only a shadow artifact. And artifacts are also used extensively. Now, in lung ultrasound, so here is an image. This is the pleura, and that is seen in all the images below. Next, coming to 3D imaging, just a brief mention. This converts the standard 2D grayscale into a volumetric data set. And this can be seen as, this is used particularly in surface anatomy, in antenatal ultrasounds, where each structure on the baby's anatomy can be well seen. So it is just by creating a rectangular or a square matrix and sending a beam through. I won't go into greater detail than this. Now, is ultrasounds all effective? What do ultrasounds do? They cause an oscillation of the tissue, and therefore oscillations of sound waves on tissue. This could lead to what is called a cavitation. This could have some effects, but by and large, it is not a major effect. There could be some thermal bioeffects. It could raise the temperature up to a maximum of about 1.5 degrees centigrade. Now, routinely, this may not be of any relevance, but in fetal ultrasounds, it is important. So scans have to be done quickly with minimal side effects. There are two knobs or indicators on your machine called the mechanical index and thermal index. This would indicate the power of the machine, and it is best not. So when you reduce your depth, reduce the sector, increase the frequencies, these are improved. Mechanical index, it is recommended that it should be less than 1.9. And so while doing an ultrasound, we follow the principle of ALARA. That is, we should use whatever are our settings as low as reasonably achievable, as low as needs to be set in order to get a good image. It is eventually an energy, and it affects the tissues it transverses, and it could have thermal and non-thermal effects, so we need to scan safely. And in order to do this ALARA, we need to use manufacturer presets. The manufacturers preset certain images. It could be pediatric, it could be adult, vascular, abdomen. We need to use those presets, adjust to the lowest power needed, lift the transducer when unnecessary, particularly when doing Dopplers. So once the Doppler image has been acquired, take your probe off and then make the measurements. If the probe continues to remain on, the baby gets, there are energy beams which are going through, and we need to reduce the scan time and not scan for extensive durations of time. So eventually, when we do an ultrasound, what is important is a good sonographer. What is important, and with a good knowledge, we need a good machine, we need good probes. But more than anything, it is the knowledge that we have in order to create good images so that we can interpret it well. So handle patients with care, handle transducers with a lot of care. Transducers are extremely expensive. Clean them well with wipes or tissue. Use a lot of gel, if possible warm gel, and try different windows but minimize the handling. So it always looks hard, it always looks more difficult, but this is what this workshop is meant to be. It is meant to simplify what essentially looks quite difficult. Thank you and happy scanning.